Hello. Welcome to the webinar of the EAFIP initiative on opportunities to tackle the COVID-19 crisis through innovation procurement from a legal and economic perspective. We welcome all the participants, not only from Europe, but also from the United States and from Southern and Central America. Before we start with our webinar, we would like to express our gratitude to all the professionals and volunteers who are working so hard to combat the terrible COVID-19 crisis situations. So to say, we salute you. Okay. For technical reasons, we have pre-recorded the sessions, pre-recorded webinar, but you still have the possibility to ask questions via the chat box. However, also due to the large number of participants, it's not able to have a direct interactions. And what we will do is that we will collect the questions and we will answer them in the coming days on the EAFIP website. We will also do that with the presentations and the video recorders. We will upload them through the EAFIP website. If that's not possible, if you cannot use the chat box, you can also mail directly to Matty van Sloten at the current email address is stated below. What is the agenda for today? First, we start with an introduction and overview of the EAFIP initiative and the actions undertaken by the European Commission. We will tell you what you can do now, and by using EAFIP methodology, how you can speed up the preparatory work in order to tackle your needs. And we will conclude with recommendations and next steps. Let me introduce you the speakers. We are very honored that we have the following speakers: Mrs. Lieve Bos from the European Commission from DG Connect, and Rainville from Vtrek, Ramona Apostol from Corvers, and my name, as I've told you, is Stephan Corvers. What is the key message that we would like to bring to you? The COVID-19 crisis situation demands out-of-the-box thinking. The procurement directives and the EAFIP methodology provide you with the flexibility needed and the possibilities to accelerate the timelines that are needed to tackle your needs. What we also show is that innovation procurement is and remains a vital strategy to target the needs of a contracting authority and of the public buyer. And last but not least, innovation procurement forms an integrated and a suitable part of a full-blown procurement program. So we will go into details into these messages in our next presentations. And for now, Lieve Bos will take it over with the actions from the European Commission.
Which actions is the European Commission undertaking? First of all, 37 million euros were made available from the cohesion policy to enable member states to tackle the COVID-19 crisis situation. This budget can be used by regions, member states in Europe, also for procurements and procurements of innovative solutions. Next, the Commission is also doing joint procurement together with member states. 4 procurements are ongoing already, 1 for personal protective equipment, 1 for ventilators, lab equipment, and test sets. On top of that, the Commission is also creating a stockpile of medical equipment and personalized equipment that will go even beyond these 4 categories above, and ultimately also have vaccines and so on, to be able to distribute all of these in case there are shortages in a coordinated way across the Union. A recommendation was also adopted that enables member states to speed up the conformity assessments of medical equipment. Of course, the Commission is also interacting with surveillance authorities across Europe to ensure that the products are still safe and healthy that reach the market. Funding from the Horizon 2020 Research and Innovation Program is also available for innovation procurements that can help to increase the preparedness for public health emergencies like the ones today. You see there are 3 topics where funding is available today with deadlines in June to submit proposals, both in the area of digital health and care, integrated care and diagnostics. Proposals can be submitted for public health emergencies like the virus situation today. Some of them are to develop new solutions, others for deploy new solutions. Check on the links on the slide. This week also the Commission adopted guidance on how public authorities can use the public procurement framework in the emergency situation of today, basically to speed up existing public procurement procedures. The Commission Joint Research Centre is also busy modeling the link between the evolution of how the virus is spreading itself and the changes in climate conditions from warmer to colder weather and so on. We have created in the domain of ICT also a repository of solutions, artificial intelligence and robotic solutions that are deployable today and can help to tackle the COVID-19 crisis. European funded supercomputers are also busy interacting with researchers and pharmaceutical companies to create a vaccine for the virus and have already identified chemical compounds that are being used by pharma companies today to create the drugs. There are COVID-19 hackathons being organized all across Europe to find new breakthrough ideas that could help alleviate the crisis situation. And all the digital innovation hubs across all the regions in Europe are being mobilized to offer their equipment as test beds for innovative solutions to public procurers. The Commission is also working with cybersecurity authorities in the member states to ensure that all the online purchasing can happen still in a safe and secure way. It is working with platform and telecom operators to reduce fake news about corona products and to ensure that networks, internet networks, will not be congested. Another important initiative that the Commission has launched already a couple of years ago that can help now is the European Assistance for Innovation Procurement. What is it doing? It is transferring knowledge about how to implement innovation procurement. It has done workshops and conferences around Europe in different domains where public procurers are active, also in the health domain. It created an innovation procurement toolkit that shows how and why to implement innovation procurement from the practical point of view, but also from the legal procedural point of view. And EAFIP is also providing local assistance to real cases of public procurers that want to prepare and implement an innovation procurement. 18 such projects are already ongoing, and you can apply today for new ones, also to tackle the COVID-19 crisis. The European Assistance for Innovation Procurement is a network. It's coordinated by Corvers, but there is a network of other lawyers and experts in each member state because it provides its services, its local assistance to any public procurer in any European member state. It only provides support to the demand side, not to companies, and more information can be found on the EAFIP website. What kind of innovation procurement are we talking about? In most situations when public procurers need something innovative and they're looking around, the solution is either already close to the market or already on the market, and they can simply use an existing procurement procedure to act as an early adopter to buy this innovative solution that is not widely available yet and potentially first tested, of course. This is when we speak about public procurement of innovative solutions. But there are also cases where procurers look around and they see nothing is close to the market to solve my need. I need new research and development to be done first. I need to compare different solution approaches from different vendors. I also want to give new innovative companies maybe a chance to enter the procurement market and not only work with existing big players. In that case, pre-commercial procurement may be an interesting tool to use because it can stimulate innovation from different companies in parallel while sharing the risks and benefits of doing this development with them in a way that enables the public sector to steer the development towards its needs. Pre-commercial procurement is simply using existing procurement procedures like the open, restricted or negotiated procedure with publication to conduct this procurement, but it's using these procurement procedures in a clever way to get better value for money outcome for the procurer and to enable companies to commercialize the solutions wider.
So what are the things that you can do now? So what we have learned over the past few years in the context of the EAFIP initiative is that the preparation phase is extremely important to set up a proper innovation procurement approach and a process. And in doing that, so this visual gives you an overview of all the steps that are needed and the methodology that is needed in order to be successful in that approach. It starts with the needs identification and the need assessment. You will have to do a SOTA analysis, as we call it. This is a state-of-the-art analysis, including the IPR search and standard analysis and a normalization analysis. Of course, you have to set up a dialogue with the market by using an open market dialogue, and that will all be translated into a proper business case. To identify the needs is extremely important. You need to understand the urgent needs, what you need now, right away, or perhaps, I don't know, 6 months or 1 year. You also need to understand the legal possibilities and challenges that you have in order to procure these needs. And for that, it is extremely important that you contact your internal legal department or you go to your external experts, like the expert from the EAFIP Lawyers Network. You also need to draft a business case to justify the urgency of the needs, to identify the cost effectiveness, and to inform the tenderer. Once you have drafted your business cases and identified your needs, you also need to understand what the market can offer or cannot offer. So targeting the market, setting up a dialogue with the market is vital for success or failure. And in the end, you also need to translate all the needs, the analysis that you have done, into proper specifications and award criteria, for example. And last but not least, do not forget to draft the right contracts for the innovation procurement approaches. What we have seen and what we have learned in the EAFIP initiative is that normally a preparatory phase will last between 3 and 6 months, depending on the complexity of the project, the complexity of the organizations, etc., etc. However, we have also learned that we can speed up the preparatory phase if you really committed to do that, and if you have the right people and facilities for that. So what we will see and what we will show is that the EAFIP methodology can accelerate the time frame for a total period of 3 to 4 weeks and not more than that. But as stated, we all believe that it is needed to speed up the process, and a prerequisite for that is professionalism of everyone in your team trying to cooperate with each other.
Hi, I'm Dr. Anne Rainville, and today I'll first be discussing some methods for end-user needs identification and how you can apply these specifically in the current time, so in cases of urgency and extreme urgency to face the COVID crisis, as well as over the longer term for standard procurements. So some of the potential topics and needs that we face now, it's not just for immediate off-the-shelf solutions, commercial off-the-shelf. We also have R&D ideas and innovations coming in the innovation pipeline that can help us meet emerging needs over the shorter and longer term. So some of these areas are for robotics, so for food delivery, transporting medical equipments, disinfecting hospitals, performing surgeries, and interacting with patients. And by implementing these, you can decrease the risk that healthcare personnel are infected by patients. Other areas are in supercomputing and artificial intelligence. So this is for pattern identification, such as for diagnostic imaging, or finding chemical compounds, such as those that could be relevant in looking for a vaccine or treatment, and epidemiological modeling. Also, we have ICU bed availability, so monitoring at the local, the regional, and the countrywide level. The dynamic prediction of needs, so connecting testing, containment measures, ICU bed availability, and integrating these with vaccine measures and containment measures at the same time. Another area is then communication and coordination, and not just between organizations of the same type, but between different types of organizations and different actors, because it becomes quite complex there. So for example, between hospitals and transporters of emergency servers. Another area is social well-being, so how to support connectedness during social distancing, providing senior-specific services and possibly interactive community programs. And maybe you could have these at the municipal level. Another idea is for digital education. So here you have digital schooling and educational efforts for disease awareness, as well as the importance of vaccination. And that will become more relevant as we get closer to a vaccine solution. So some of the methods we have for needs identification for innovation procurements, the choice that you have will depend on the degree of urgency. So we make a distinction between what is a time of urgency and what is a time of extreme urgency. And this distinction is based on jurisprudence. And my colleague, Dr. Ramona Apostol, will discuss this difference more in depth in the next set of slides. For a state of non-urgency, a more comprehensive user needs assessment can take place because you have more time to do it, basically. So the needs for this can be predicted over the mid and long term, so not just the immediate necessary relevance needs. And for these mid and long-term needs, they can also require R&D or more significant innovation efforts to capture things that are coming down the pipeline. But in comparison, when you have situations of extreme urgency, you have critical needs, it's probably immediately evident. So in this case, you have little or no time to do the needs assessment. So some of the methods that we use for needs identification, so again, it will depend on the degree of urgency that you have. So some of the methods include interviews, surveys, and collaborative workshops. And collaborative workshops are especially useful, for example, if you're doing a joint procurement or you have a consortium or a buyers group. Interviews are a better tool if you want to derive a really rich data sets that really describes the whole picture and you have not so many end users, so you have resources to consult all the people who should be interviewed. Whereas a survey is better if you have a lot of different end users and a large number of end users, and you want to collect information in a very standardized format. So once you have, for example, different types of needs that you're considering, you want to prioritize them to make kind of a long list and then a short list to help you focus on which one you want to work on. And here we recommend using transparent and semi-quantitative methods. And this helps support consensus, especially when you're using joint procedures and a buyer's group. So you have to report justification for the chosen procurement procedure. And this is important because you're describing the methodology you used, the needs that you identified, the source of the needs, so whether or not it could be foreseen. And this is the rationale for the procedure selected. And justification in this sense can be provided by a business case. And later on in the slides, I'll discuss how we connect the needs identification to the business case and use it as an input to kind of integrate the whole project. So here's an example of how you can perform a needs identification in an accelerated manner. So either in an extremely urgent or urgent state. So first you want to identify who the end users are. I'll use an example in this case. So for example, in the area of imaging, like for CT scans to diagnose and manage COVID patients, there are upcoming imaging devices using artificial intelligence. So it's an innovative area we can consider. So using this example, the end users would be nurses or doctors involved in diagnosis and management of COVID patients. Next, you want to describe the current challenges which are faced by end users, and ideally you should let them describe it, but if you're in a time crunch, you can use different methods to do so. So here, an example is the patient diagnosis for COVID-19 currently takes too long and they're not very accurate. So what are the consequences of these challenges? That the low speed and accuracy of the current technology, this results in time delays for correct diagnoses, it consumes time resources of nurses and doctors, and it reduces the number of patients that can be treated per hour. So based on this, you describe the innovation needs, or just the needs, in terms of function and performance. So for example, a faster and more accurate diagnosis would reduce the time per diagnosis per patient, and this would free time resources of nurses and doctors, and increasing the number of patients that can be treated per hour. And we make a big note here that don't think only in terms of technical specifications, because it can lock you into certain ways of thinking, but also into already established ideas from suppliers, and it doesn't give you a whole picture of the process and the problem solution space. So we recommend to be as open as possible in this user needs identification process. And you can be aided by these tools that you have at hand to help you guide through this process. So it's still open, but there's room for to move forward in an organized way. One example that I have, so an example here, so a prescriptive specification would be one where you're looking for personal protective equipment, for ventilators, or for digital teaching platforms. And in comparison, a functional specification, which is what we promote more through the user needs assessment, would be procuring for personal protection, for breathing apparatuses, or for education. So that's the difference between prescriptive and functional specification.
Good morning. My name is Ramona Apostol. In my part of the webinar, I'm going to provide you an overview of the various procurement approaches and procedures that are available within the legal framework of the EU public procurement directives, and that may be used by contracting authorities over the course of the COVID-19 crisis. I will try to categorize the different applicable procedures depending on the availability of the solution that is needed by the contracting authority on the market, or depending on whether the solution is still in one of the stages of the R&D cycle, and also depending on the level of urgency of the need of the contracting authority. And here you can see for commercial off-the-shelf solutions, contracting authorities has various options at hand for procurement procedures. In case of extremely urgent needs, it could apply the negotiated procedure without prior notice. It is a flexible, it is a short procedure with a duration of weeks. For the less extreme urgent needs, but still urgent, contracting authority has at its disposal the open, restricted, or competitive procedure with negotiation with accelerated timelines, in which competition is still ensured, but the time for performing, for awarding the contracts are shortened. Of course, not all needs of contracting authorities over the course of the COVID-19 crisis will be urgent, and this is something that contracting authority also have to be aware of. For those non-urgent needs, the standard procurement procedures have to be followed as prescribed by the procurement directives. The contracting authority during the health crisis, current health crisis, is confronted and will be confronted with the need to think out of the box to spot innovative solutions. We have seen, for example, in the last couple of weeks, unavailability of needed supply that is due to disruption in supply chains or peaks in demand. Contracting authority might be forced to think of alternative innovative solutions to their regular purchases. In case contracting authority identifies a solution that finds itself at technology readiness level 7, and this is a solution that is already in the phase of a prototype, in the form of the prototype, contracting authority may apply a negotiated procedure without prior publication. And it could be done, do this in also in case of an urgent need, when it needs to quickly test a solution in its operational environment before it is decides to buy commercial volumes, or in a less urgent need when the solution is needed on a longer term, but still contracting authority can use the flexibility offered by negotiated procedure to test specific prototypes. It is, as it already mentioned, it's just the only concerns the testing of the innovative prototypes, not the purchase of the commercial volumes. Whenever the contracting authority realizes that it needs an innovative solution that finds itself at an earlier TRL level, for example, starting from TRL 3, which is a proof of concept, it has the choice to choose between a pre-commercial procurement and an innovation partnership, depending on the desired approach. A PCP will only cover the R&D phase of the solution, while innovation partnerships will also involve the purchase of the commercial volumes in case of successful outcomes of the R&D phase. In the case of a PCP, both PCP and innovation partnership are most suitable for non-urgent need, because they the research and development phase do take time. With the difference between the two procedures, that in the case of innovation partnership, there is no automatic presumption of no state aid being granted, unless the contracting authority is able to prove that the innovation partnerships concerns a unique or specialized solution, and this would only be the case when the contracting authority is the unique buyer and the all able and capable market operators have been allowed to participate in the partnership. So these are very restrictive conditions. In all other cases, contracting authority might have to pre-notify the innovation partnership to the European Commission. Also, a large important difference between PCP and innovation partnerships is that PCPs are more friendly to small businesses and startups, and are encouraging a larger degree of competition, and also attract the non-usual innovative companies that are not known to the contracting authority. For a solution that finds itself at TRL 9, so it finalized its R&D cycle, but it is not yet available commercially, it has not been launched, it has not been placed on the market, contracting authority can decide to deploy a so-called public procurement innovative solution, PPI, and this is suitable for all degrees of urgency, extremely urgent, urgent, or non-urgent needs. PPI is not a procedure as such mentioned in the procurement directives, but it's an over-encompassing term that refers to the type of solution that is being purchased. The procedures that can be applied are those mentioned in the procurement directives, and it depending on the urgency, they could range between the regular standard procurement procedures with their regular timelines, or in case of urgency, the accelerated procedure with shortened timelines, or in case of extreme urgency, again, the negotiated procedure without a prior publication. Also, details on the conditions and the types of procedures that can be applied in these times over the course of the health crisis can be found also in the very recent guidance of the European Commission that is mentioned at the bottom of the slide. For your convenience, I included all the applicable procedures that are provided in the procurement directives, structured based on the stage of development, market availability of the contract, of the desired solution, and depending on the degree of urgency. Also, the applicable articles from the directive are mentioned of the directives are mentioned per procedure. For even more visual illustration, you can take a look at this matrix that also places the applicable procedures on the line, technology readiness line, and degree of urgency. But we have been talking about the technology readiness level, so I want to show you the overview of these levels with the place where the different procedures become available. So here you can see in case of commercial off-the-shelf solutions that are either urgently, extremely urgently needed, urgently or non-urgently needed, we are talking about solutions that find themselves past the TRL 9 and are available commercially, and they can be purchased through the procedures that we mentioned earlier. In case of a solution that finds itself at TRL 7 and it's a prototype, we can, contracting authority has the option to negotiate a contract for the prototype testing directly with contracting with market parties. In case of a solution that finds itself at an earlier TRL level, starting could be a TRL 3 or 4 or 5, PCP can be deployed to bring the solution and speed up its development and bring it to a later TRL level when it could be deployed for the use of the contracting authority. The innovation partnership, again, it covers the space between TRL 3 up to and including TRL 9, which is already the commercial phase when the solution developed can be purchased in commercial volumes. For PPI, Public Procurement Innovation Solution, we are talking about a solution that finds itself specifically at TRL level. So it has not been commercialized yet, but it is ready for commercialization. In the last part of my presentation, I'm going to go through the legal conditions for the application of three of the procedures mentioned: negotiated procedure under extreme for reasons of extreme urgency, accelerated procedures for reasons of urgency, and the negotiated procedure for prototyping, for testing of an innovative prototype. We will start with a negotiation procedure for without prior publication for reasons of extreme urgency. I would only want to point out and stress out that it only is suitable for the most urgent needs during the outbreak. And a contracting authority wants to deploy such a procedure, it has to prove the existence of three cumulative conditions: the existence of unforeseeable event, in this case, the outbreak of the COVID-19. It is, of course, an unforeseeable event. Contracting authority could not have predicted this event, and the recent guidance of the European Commission also specifies that the rising event of rising numbers of patients that cannot be predicted by contracting authority will continue throughout the crisis to constitute such an unforeseeable event, justifying the negotiated procedure without prior publication. Second cumulative condition is the extreme urgency. This must not be attributable to the contracting authority, so delays or lack of action of the contracting authority should not be causing the extreme urgency. And also, the contracting authority has to prove that the accelerated procedures doesn't have sufficient time at its disposal to perform an accelerated procedure. So the need is a lot more urgent, and it does not allow up to 1 month to the contracting authority to fulfill its need. Also, the causal link between the unforeseeable and the extreme urgency. Not all purchases suddenly become extremely urgent because of the unforeseeable. Only the needs that are linked to the unforeseeable event may be purchased through the negotiated procedure without prior publication. It is advisable that contracting authority keeps track of its motivation through an individual report. It does a case-by-case assessment that is repeated for each subsequent and additional procurement. Also, it is important that the contracting authority keeps a log and keeps track of the reasoning per procurement for future auditing. Also important to mention are the conditions for conducting the procedure. So there are no procedural requirements mentioned in the procurement. There is for the deployment of this procedure. There is no publication requirement. There is no time limits. However, there are certain conditions under which this can be performed. The contracting authority must limit the purchase through the negotiation to what is strictly necessary. So in both quantities and length of contract, what is strictly necessary to address the extremely urgent situation. And contracting authority has wide flexibility to negotiate directly with the potential contractors. It can do so through phone calls or even visits to suppliers who have the required stocks. There are no minimum numbers of candidates to be consulted. However, there is a limitation in negotiated one pre-selected contractor. The contracting authority, when it decides to only contact one market party, it has to prove that that party is the only one able and capable to deliver according to the technical specs of the contracting authority and according to the required time and quantities. Of course, it is good practice, even in times of extreme urgency, to aim to achieve value for public money. So the contracting authority has to plan efficiently to allow negotiations with multiple contractors as quick as these may be, and to potentially secure price reductions contractually through perhaps mentioning ranges of supplies, deliveries that would trigger automatically price reductions. In the case of urgency, as I mentioned earlier, the accelerated open restricted procedure and the accelerated competitive procedure with negotiations is available. The burden of proof is not the same as in the case of extreme urgency. However, the urgency has to be duly substantiated, and the contracting authority has to show that the urgent situation renders impracticable the applicable regular timeline. What is the reduction in timeline? In the case of an open procedure, contracting authority should give 15 days for the submission of bids. In the case of restricted procedure and competitive procedure with negotiation, 15 days for requests to participate and 10 days for the submission of bids. This procedure, unlike the negotiated procedure without prior publication, it ensures transparency and equal treatment. So in this case, contracting authority still has to prepare procurement documentation. It has to publish this procurement documentation. It has to allow parties to submit their bids. It has to evaluate the bids. It has to announce the award and motivate the award to the winning party. And my last slide regards the conditions for the application of the negotiated procedure without prior publication for prototype testing. It is suitable, as I mentioned earlier, for urgent and non-urgent needs. It regards the purchase of an innovative prototype for the purpose of testing its performance, of studying its performance before it is before that product is purchased in commercial volumes. This prototype testing is different from conformity testing and standard testing in PPI and standard procurement. Prototype testing takes place at the TRL level 7 of a solution. If a contracting authority concludes that the prototype has been successful, it could support the market party to perform the conformity testing in order to be able to bring its solution to the market. The conformity testing is assessment of compliance of the innovative solution with the essential health safety requirements that laid down in European regulations for specific products, and it is performed by separate authorities in each member state, and it has to be a market party that wants to bring a solution to the market has to obtain this conformity certificate in order to be allowed to place its product on the EU market. Be aware that that the European Commission has also released recommendations to member states to prioritize personal protective equipment, the conformity testing of conformity assessment of personal protective equipment and medical devices, and also to allow flexibility in the market surveillance of these products, to allow products that have not gone through the full conformity assessment procedure to be offered on the market if they do comply with the essential requirements. So there is no concession on the safety of the products, only a recommendation to speed up and to make it more flexible, the whole procedure. So the prototype testing is also different from a standard testing in a public procurement of innovative solution or even standard procurement. I mean, in a public procurement of innovative solution, a contracting authority may still want to do a test, perhaps for checking whether the offered solution actually fulfills the technical performance and functionalities that it has that has been offered in the bid of the market party, and also throughout the execution of the contract, the contracting authority may want to test and check whether the contractor delivers the level of quality as agreed upon in the contract. With this, I end my part, and I give the word to my colleague, Anne Rainville.
Okay, so in this section, I'm going to cover the open market consultation as well as the state-of-the-art analysis. And because we're talking about using an accelerated procedure in the face of COVID, I'll also describe how to identify suppliers via the state-of-the-art analysis, because the open market consultation can often take too much time to do, although we can accelerate it. So first, I'll go into the state-of-the-art analysis and what it is. So through the state-of-the-art analysis, you want to identify prior art that's held through intellectual property in the public domain. And this IP can be patents, it can be standards from either standards setting organizations or standards development organizations, or literature, such as academic articles and peer-reviewed publications. One thing to consider for state-of-the-art in the COVID crisis, it's a rapidly changing landscape and there's new alliances and there's high uncertainty. So we always have to keep that in mind, especially now. The demand is extreme and it's dispersed and everybody wants the same thing at the same time. So it means you have competition among the buyers, which can change the behavior of the suppliers. So in the state-of-the-art analysis, you can identify suppliers who own IP in the relevant jurisdictions, which meet user needs and any technical requirements. So if you look at the diagram on the right, you have all patents here, so the whole 990 million patents worldwide. You reduce that to the patents which meet user needs by inputting your search criteria. And then under that, there's a subset of patents which meets user needs as well as technical needs. Under that, you look for the relevant patents in the relevant jurisdiction. So this is patents which meet both technical needs and are jurisdictionally relevant. So you have technically and legally relevant state-of-the-art through this process. And the tool that we use to do this is the IPlytics platform. So this is an online-based analytics tool, and it uses big data to analyze technology and market landscapes. So in patents, you can look at patent filings, valuation, transfer, and litigation, and other IP like scientific articles and standards. And one thing to especially look for to red flag are standard essential patent declarations. And these are patents that are recognized by standards as being essential in order to apply the standard. And they have licensing terms on France, so fair, reasonable, and non-discriminatory. And there's about 250,000 standard essential patents for all the patents out there. And we have to look out for these because as a contracting authority, if you choose a solution which has a standard that recognizes a standard essential patent, it could provide more opportunities to a certain market party. So think about it in terms of competition when you're looking at that. So on the platform as well, they provide company information and startup, so investment deal for startups worldwide and startup trends and investment amounts. So that can also be interesting if you're particularly looking for SMEs. So going back to the accelerated process you can use in terms of urgency and extreme urgency. So in order to do this, as a disclaimer, you need the right tools and the skills to do this in one day. So this is why we recommend to use a platform like this and to ask for expert help when you're performing the search. The first step you want to do is take those user needs that you have identified in the first step and derive keywords from them. So using the example of the imaging, the diagnostic imaging that I used before, we can use keywords such as medical diagnostic, imaging, hospital, emergency, and technology. And next, you want to include the functional units. So treatment time, diagnostic time, or patient outcomes. So you take these and you input them into the search platform, and we recommend looking in the patent abstract, the English abstract, because most patents have this in a translation available. And you have to use the correct entry methods, such as Boolean operators, to make sure if you enter imag with the little star, you get imaging, images, and all the variants that can come for that. So you're not unnecessarily reducing the size of the patents that come out and losing potentially relevant patents through your search results. The next thing you want to do is to search and analyze the results, and you do this by just skimming the titles and abstracts to see if they're relevant to the topic at hand. You can also look for different indicators, so how many patents did you get, What is their geographical location? So are they in the EU or abroad? Who are the leading companies in this area? Are they big companies, SMEs, or are they multinational? And the indicators can include technical relevance. So this is one that we use with IPlytics, and this is for normalized forward citations. So this is the normalized number of patents who have cited the patent that you're looking at. And if you have a higher normalized forward citation rate, it's a sign of a higher technical relevance of the patents of interest. So once you've done that once, you reiterate it as many times as possible in order to fine-tune the results until you get a reasonable number that's specific and relevant to your problem. Then you have a technical expert who reviews these patents and the abstracts and the whole body of the patents to determine if they're relevant, and then make a short list. And yeah, this number is usually about 15 patents because it takes a while to go through them actually quite comprehensively. So it depends on the time and resources you have. For one day, we won't go much above 15 patents. So then, given this, if the solution that you want is already on the market, you can make contact with the relevant manufacturers or the distributors or the brokers and see if they can deliver the products, or what quantities they can deliver, and what timeline can they deliver these, and if they have compliance with relevant technical specifications or conformity assessment. And you can make this contact like using the open market consultation. And again, the open market consultation is to check the information that you've gathered to this point in time and see if it's accurate with the parties who would be your suppliers. So this is an example of the accelerated patent search. So in this graph, in this chart, you see a list of applicants. So we've performed a search. We have a group of patents, and these are the applicants who have the highest patent count within this group. You also see family share. So the patent family share is a measure of how internationalized the firm is compared to other firms in the area. We see market coverage, which is the normalized number of countries in which the patent has been filed, and technical relevance, which again was those forward citations, meaning how often that patent is cited as prior art by other patents. So you have this list of suppliers. You can contact them directly if the procedure allows for, such as in the negotiated procedure, and then check if they can provide what you want when you want it. So next we go on to the open market consultation and how to use this in an accelerated procedure. So in a case of urgency, but not extreme urgency. We again use the needs analysis and then the state-of-the-art analysis as input for this to check with the market. And these provisional findings are what we check. So there's two options we recommend here. They both take about the same time, so about 16 days. The first one is an electronic survey, and the second one is a webinar. So the steps under the electronic survey, you would prepare your publication for TEDs, as well as questionnaire and outreach activities. So that takes about 3 days. You publish it on TED on the 4th day, and on the same day, you can outreach through other channels, such as EASMA. I'll talk about that in a second. Also refer the questionnaire, so send out any questionnaires via the EU survey on the same day. That can be available online for 7 days, and you receive all the answers, day 11, for example. You analyze the answers and prepare feedback to the market over a 3-day period after that. And then on the last day, you can publish the outcomes and the conclusions via TED on day 16. So the webinar scenario is similar to this, in that you first prepare the publications for TED and the Q&A sessions and outreach activities. That takes 3 days. You publish it on TEDs, and the registration details for webinar are also published on the 4th day. At the same time, you outreach through other channels, such as EASMA, to increase your reach. That stays up for a week, and then on the 11th day, you have a webinar and the Q&A session. Then you take 3 days after that to analyze the answers and prepare the feedback to the market. And finally, on the 16th day, you publish the outcome of the conclusions. And EASMA is the executive agency for small and medium-sized enterprises. And this has been set up by the European Commission to manage on its behalf several EU programs And these are in the field of SME support and innovation, as well as environment, climate action, energy, and maritime affairs. This is also run through EIC, which is the European Innovation Council, which serves as a sort of accelerator for startups. And most importantly here is when you publish the open market consultation, you should contact us on the same day and we send it through to EASMA. And then this way you outreach to 6,000 companies specifically who are innovative SMEs, startups in high tech. And 40% of these are working in the healthcare sector. So it increases the likelihood that you get a lot of rich, detailed information on how your needs could be met. So next I'm going to talk about how to draft the business case. So I say business case, but you could also refer to it as a value case, as is often done for government's calculations and for contracting authorities. Whether you call it value case or business case, it's a decision support tool to help identify the highest value option. And in terms of the value case, it's the highest value to society. So not just the highest financial returns for investors, for example. And you use the business case. I use them interchangeably, business and value, in this presentation. So you use the business case to justify the urgency of needs, cost effectiveness, as well as to inform the tender. And you inform the tender by taking what you learned in the business case and transforming it into the technical specifications and the award criteria. So you have continuity between the phases. And what most business cases do is compare costs, benefits, and risks of different scenarios, so different options or different ways forward. And you can do this using different calculation methods depending on the data you have and what you want to achieve with it. So some of these options that you have are in your business case toolkit. The first is probably what you're most familiar with, and this is a cost-benefit analysis. This is possible where all costs and benefits are monetized. For example, with net present value, where you calculate the discounted monetary value of choosing one option at the present time. And for net present value, you use a discount rate as a number of months from the future, so you define your timeline. When you have benefits in non-monetary units, but you have costs in monetary, then you can consider a cost effectiveness analysis. But if you have more semi-quantified factors, then it's more relevant to use a multi-criteria decision analysis. But here the benefit is, and also for the user needs assessment workshops, this is a valuable tool to go from the long list of options to the short list of options, because you can include weighting and ranking in it to reflect the preferences of your end users. What is really important to do is to identify the risks and then try to quantify them as much as possible. So integrate probabilities in your calculations. And this allows you to incorporate dependencies and uncertainties to make your model more reflective of the real life situation. And you should also do sensitivity analysis, and this helps you to estimate the rigor of your analysis and conclusions. For example, this includes changing your value inputs by 5, 10, 15, 20%. So within whatever boundaries you could realistically expect the values to change in real life, and see if this changes the outcome of your calculations. And if it changes the outcome, then the analysis is not so rigorous, and you should either not make conclusions based on it or make very, very tentative conclusions. It's best if you go back and improve the model and see where you could make it more accurate, if this is the case. So I'll discuss now how you can do an accelerated business case. So for an urgent or extremely urgent circumstances, more likely just urgent. This takes about 2 to 6 days. And the first thing you want to do is take those functional units you have gathered from your needs assessment and quantify them. And you want to quantify them as much as possible because it supports absolute comparison. So for example, cost would be in euros or duration of hospital stay would be in hours. However, if you can semi-quantify something, it supports relative comparison, such as between options. So this is when you could say cost savings are either low, moderate, or high, or frequency of occurrence is seldom, often, or continuous. And then you would assign those scores on a Likert scale, like 1, 2, or 3. So that brings them in a more concrete way. Next, you want to model relationships between these functional units to an outcome, and the outcome could be value, cost savings, reduced duration of hospital stay. Then you define scenarios, including do nothing, so including the business as usual approach, and you usually use that as your baseline. The different scenarios, you should have at least 2 other scenarios. They could be different purchasing options, for example. Then you choose the appropriate tool to compare between the options, and you calculate according to the tool chosen. Once you have the calculation done, you compare the results, and on this basis, you determine the best scenario. And this provides justification for the decision on why you've chosen to go for one area over another. So especially in the COVID crisis, there may be aspects where you can have compromises or trade-offs that have to be made due to urgency. This might be between costs, the accuracy of tests, delivery timelines, vaccine effectiveness, or quantities available versus quantities required. So important in terms of innovation is to plan future procurements using the results that you've gathered for the business case today. This can reflect the degree of research and development or innovation required from time to market, so from the information you've gathered from previous steps, and it can be for mitigation or adaptation and help you increase your resilience to future crises. So we can take advantage of that in the current situation. So this is just a brief example of how you could organize your information for the business case. We have the units on the left, we have weighting in the second left column. The diagnostic accuracy is the only non-monetized factor here, so it receives a weight of 100, but if we had more, all the factors would add up together to 100. Then we have the baseline and the 2 options. So we have the monetary factors, so we have capital expenditure, CapEx, operational expenditure, OpEx, and personnel time per diagnosis. And we can calculate this as, so if it's 2 hours per patient and it costs 40 euros per hour for personnel, then you have 80 euro cost per diagnosis. And this is a way you can bring that into the value calculation. So I'll just close this section talking about innovation procurement and some supporting schemes that we have available now. So now regional expert centers are supporting their regional contracting authorities and their public buyers. And one of them is in Spain, so in the Aragon region, and this is IAX. They work in the health sector, and they provide services relating to needs analysis, state-of-the-art analysis, technical evaluation, testing facilities, and brokering for national notification bodies for conformity testing. Another one is Innovirus, and that's in the Brussels region, and it operates in health and ICT. And it provides assistance regarding funding schemes, as well as technical evaluation and brokering for conformity testing. And these organizations exist to share information and serve as knowledge hubs when they're connected. They share lessons learned and best practices. So not to per se conduct procurements together in a joint fashion, but to help plan for and prepare and improve the quality of the preparation going into their own respective procurements. And the EAFIP initiatives have started the bilateral cooperation between IAX and Innovirus. There's available contact information for IAX at the end of this presentation, so you can get in touch with them if you like.
So I'm seeing that we have already received several questions through the chat box and also through email. As I've told you, we will collect the questions and we will answer them on the EAFIP website in a few days. For now, I think that we can continue with our presentation. And we come to the conclusions and recommendations. Innovation procurement, as we have shown you, can play a vital role in tackling your needs. And the needs are urgent. So there are several problems with availability of the products that we really need, and that can relate to a shortage of supplies of components, a login situation for third-party countries, or even quality issues or combination thereof. And innovation can really help you in order to tackle these issues. Innovation procurement is really more relevant than ever. There is really a need for innovative, creative, and out-of-the-box solutions. What's also clear is that innovation procurement is not a standalone approach, but that is an integrated and insoluble part of a full-blown procurement program. Innovation procurement is not only possible for big projects, for supercomputers or something like that. It is also possible as a fast track, and you can use it on a small scale if you have the right tools and expertise, and if you're using the right methodology. And EAFIP can support you in this. What are then our recommendations? First, on policy level, we have to rethink the login from third non-EU countries and translate that into beyond state-of-the-art needs that can be delivered in Europe. We have to steer and coordinate regional, national, and cross-border joint innovation procurement. We need to scale up the demand. At the same time, we also need to rethink the procedures to avoid competitive demand behavior between regions and member states for the same products, because that's completely counterproductive. Sorry. Then recommendations from a business and economic perspective. You have to make use of the synergy between procurement and economics. Early needs identification can drive and speed up innovation. Please use the business case methodologies of EAFIP. It can really help you speeding up everything. And you need to use market analysis to understand the market capabilities and also to prevent opportunistic behavior of the suppliers. From a legal perspective, as a conclusion, as the last recommendations that we would like to give, please ensure that you always draft a legal justification for using the procedures. Also use open sources like provided by the EAFIP initiative or by the European Commission, and team up if needed with your national or regional or local experts. I also would like to point out the possibility that you can apply for assistance until March 31st of this year, and we will try to support several innovation procurement projects throughout Europe. And here you can see the link where you can apply for the free assistance. Here are some resources that you can use and reuse, not only from a practical perspective, but also from an academic perspective. And before we come to a conclusion, I really would like to thank several organizations, several people. First of all, I would like to thank Bart and Red from EASME. That's Executive Agency for Small and Medium-Sized Enterprises, to provide the contracting authorities and public buyers with the unique possibilities to have an outreach to approximately 6,000 high-tech SME companies in Europe. That's really a unique channel that we have and that we can use and reuse. I also would like to thank EAX from Spain and Innovators from Brussels for their commitment to support their regional contracting authorities in speeding up innovation and procurement processes by delivering their expertise and know-how. And here you find the contact details for them if you want to contact them if needed. And as a conclusion, I really would like to thank everyone who have participated in this webinar. I believe that we have more than 400 or 500 participants, so it has been it was a great honor to provide this guidance to you. If you still have some questions or remarks or comments or suggestions to improve the methodology, please feel free to contact us on the email addresses as stated below. For now, thank you very much, and I have one message for us all: let us unite to combat COVID-19. Thank you very much.